In my very first week of my master's research, I met a 4-year-old girl who was diagnosed with cancer. She was nearing the end of her treatment, and I found out that her doctors and parents were actually discussing the pros and cons of prematurely stopping that treatment. And I didn't understand. Weren't these drugs saving her life? I mean, why take that risk? What I learned was that while these drugs were saving her life, they were also causing her to become profoundly deaf. What an impossible situation for any parent. How do you decide to cut your child's chemotherapy short so that they don't lose their hearing for the rest of their life? But what if we didn't have to choose? What if there was a way to prevent hearing loss altogether? There are 2 main chemotherapy drugs used in North America. They're widely used, they're extremely effective and very successful, but they have a really bad side effect called ototoxicity. Ototoxicity is toxicity of the ear, which results in hearing loss. It's been shown that even a mild hearing loss early on in life can lead to deficits in school performance, social interaction, and cognitive development. And 60% of patients taking these drugs lose their hearing. What's more, it's irreversible. Ototoxicity is permanent. So our only hope is to prevent this side effect before it happens. But the problem with prevention is that we don't know which patients are going to develop ototoxicity. It's extremely variable. So the task becomes, how can we predict who the susceptible patients are? And the answer lies in DNA. It is largely thought that there's something in a patient's DNA that can tell us whether or not they're going to develop ototoxicity. These are called genetic variants, which are essentially mutated genes. Now, my research aims to find out which genetic variants are associated with ototoxicity. How are we going to do this? We've recruited 215 patients. Each patient gives us a blood sample so that we can analyze their DNA to see if they have these variants. And we follow them throughout their treatment with hearing tests to see if they develop ototoxicity. Now, what we found is that there are actually 8 genetic variants which are very likely associated with hearing loss. These 8 can now become biomarkers for susceptibility. What does this mean? Take, for example, a 4-year-old girl who comes into the clinic and is diagnosed with a brain tumor. Doctors will be able to reassure her and her family beforehand, listen, you don't have any of these 8 genetic variants associated with hearing loss, therefore we can go ahead confidently with a full course of chemotherapy. Alternatively, they might say, okay, you have the LRP2 variant. This has been shown to be associated with hearing loss. Don't worry. This just means we have to modify your treatment plan ahead of time in order to avoid hearing loss. And there are things we can do. We can lower dosages. We can spread out dosages. We can give a different combination of medication. But it all starts with finding out which genetic variants are associated with hearing loss. With these biomarkers in hand, doctors can identify susceptible patients, modify their treatment plans, prevent ototoxicity, and we can allow these extremely effective chemotherapy drugs to do what they do best, save lives. Thank you.